Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, so you can make use of it for study purpose. Thank you very much. My dear friends, as usual, today we will discuss about one of the very important topic. Of course, this will not be a long-term discussion. It's a very short discussion, but it's a very important issue, that is about autism. The question is why the incidence of autism is increasing nowadays. As we know that autism is one of the very common problem nowadays. It is also a burning problem and also the challenging problem. It's very disheartening to see when parents bring their kids with the autism, and when we imagine the situation of the child and also when we imagine the situation of the parents, so we feel very much bothered, and it's really painful to imagine that situation. Anyhow, the question we have to ask retrospectively, why the incidence of autism is increasing nowadays. To find this question, to find the answer for this question, now we will start thinking retrospectively. The question will come retrospectively, why about 40 or 50 years back there were less incidents of autism in the society. So when I say this, when I ask this question, so most of us immediately answer that in that time also there was autism, but it was not diagnosed. Nowadays it is diagnosed and therefore the cases are increasing. Okay, if I agree with this issue for a moment, okay, in those days, about 40 years back or 30 years, 40 years back, the incidence of autism were there, but it is not properly diagnosed. But at least in the elder society nowadays, we should have find similar cases, isn't it? But if you see the elder population in the present day, the society, we find very less cases of, or we reported cases of autism in the elderly is very less likely. Okay, very minimum or less likely, or we cannot find. That means that in those days the autism incidents were not there. If autism incidents were there 40 years back, left undiagnosed, at least in the present elder society we would have been seeing more number of autism cases, but it is not so. So therefore now this is really a time to think retrospectively. Okay, so 4 decades back there were very less incidents of autism compared to the present day scenario, but nowadays it is dangerously increasing, and we need to find the answer for this question. So that is today's topic. Now when we start thinking retrospectively, 40 years back, you just imagine the lifestyle of the person and how relaxed he is, and he is more worried about his day-to-day activities. He is only struggling to complete the day-to-day need, that's all, and he is never thinking about 5 years, after 5 years what will going to happen, or after 10 years what will going to happen. So this particular thinking was never there in those days, and they were really struggling to fulfill their stomach for the day itself. Okay, so if today morning and today evening, if it is going smoothly, in those days a single day, if it is going smoothly, that is sufficient for them. So they were also happy, and they were also happy with whatever they have. Okay, so they don't have more greedy. They are not so much greedy as the society is nowadays, or they are not so much focused on future as the society today. So this is one of the basic thing changing the lifestyle. Number 2 is mechanical lifestyle. So previously the life is filled with the emotion, life is filled with the friendship, life is filled with the interactions, life is filled with the friendships and so many other aspects, and helping others, and also be a part of their happiness and also the sorrowness. These are all the part and parcel of the life in those days, 40 years back. But if you observe very clearly, as we change ourselves into a mechanical lifestyle, and we are just focused on ourselves, our kids, our home, and that's all. Okay, so this is another important thing which is changed in last 40 years. Now just you take these 2 points, change the lifestyle and change and the adaptation of the mechanical lifestyle, and what is its effects on the baby. Okay, growing baby at the age of 1 year, 2 year, or 3 years, who want to explore this world, and that baby is now confined to a mechanical lifestyle, and that restricted the baby's activities with, or baby's interaction with the environment. Now baby is not exposed to outside, baby is not exposed to the friends, baby is not exposed to the universe, baby is not exposed to the neighbors. Okay, so interaction of the baby will be greatly get disturbed, and we know that in case of autism, two important things are there. One is language milestone and another one is social milestone. These two milestones are greatly get affected, these two domains of milestones are greatly get affected, and that is one of the reason where the number of cases of autism is increasing as day passes. Because as the day passes, you just don't think about 1 or 2 years, just take a look since last 40 years how we have changed ourselves. You just imagine when we are in the childhood period, how we were interacting with the people, okay, how we are interacting the world, and what you are offering to your kids. Compared to that, it's very less, very less. There's a lot of change in the lifestyle, and we are completely adapted to the mechanical lifestyle. We are overprotecting our child, we are not giving much scope for interaction with the world, with the family, or with the neighbors, anything. Now when this social interaction will not increase, definitely the social developmental milestone get affects. Similarly, the language, the intercommunications, that also go down. Now these are the two important issues. Third one is totally we are cut off from the family nowadays. Now cut off from the world and also from the family very slowly, because we are now in the last 40 years there is the Indian the culture that shift to the joint family to the nuclear family. Nuclear family, father, mother is there and a kid is there, and apart from these three, the child is not exposed to any of the other persons. He maybe get exposed in the school, but in the school there are so many restrictions are there. Okay, but think about your childhood days, how we were doing and how we were interacting, and that means how we used to play with our friends. Most important thing which comes here is joint family. India is basically a joint family country. That means we believe in a family system. In that also, in Indian olden days, there was a joint family. Nuclear family is is the evaluation of the modern world. Okay, it is not the evaluation of the Indian old Indian heritage. Okay, so joint family, what is the role of joint family and how it will going to help to the baby? That is very important. Joint family, we have got so many members. Grandfather, grandmother, chacha hai, nani hai, mausi hai, and so many cousin sisters will be there, cousin brothers will be there. See, in the joint family, a child will have different people of different age group. So there are so many kids were there of same group, or maybe lesser age group, maybe 1 or 2 year elder age group, and so this is in the childhood period. In the childhood period, the child is getting, a growing child is getting so many options. He can play with who is younger to him, he can play with who is older to him, okay, and there are so many people are coming, and these kids are interacting together, they are sharing their ideas. See how the communication skill develop and how the speech develop. There is no need of a play school in those days, because a joint family itself is a play school. Okay, and if you come to the elderly part, father is there, mother is there, chachi is there, mausi is there, and so many other people of different age group, grandfather is, grandmother is there. See, that child is receiving the love, concern, sympathy from all the group of people. Okay, around the clock somebody is coming to the child and talking to him. Okay, never the child is left alone. That is the main issue. But now what we are doing is, your child is alone, father is also busy, mother is also busy, they are going to their office and their work, and child is taken in custody of the caretaker. A caretaker, what she will do or what he will do, so its only intention is make the baby quiet and make the baby sleep. So now there is no interaction to the babies at all. So this is what we are losing nowadays. So this is the importance of the joint family, and to some extent joint family may be sometimes problematic, but if you look into the developmental milestones, development of your child, future of your child, how important is joint family? Okay, every day is a play school day for a baby, from the morning to evening or night hours. And there are so many people like grandfather, grandmother who are telling so many stories, showing their love and compassion to the baby, telling the stories and always keeping the baby happy, and round the clock baby can play. Now this is one thing. Then we slowly shifted to the nuclear family. In the nuclear family also, if the mother is considered as the first teacher of the child and or baby, and whether mother is available around the days nowadays, no, she is also going to the work and only Aya is available and there is no interaction. This is how we missed, and this is one of the important cause why a small tendency of autism which would have been present at the initial part of the life will grow into a bigger size and develop into a completely developed case of autism. Okay, I will not say that the autistic nature of the child was not there 40 years back, but 40 years back, although this autistic nature is there in the child, because as it is exposed to such a wide variety of the joint family, wide variety of interaction is available, that mild problem will be corrected by itself, and at the end of 6 or 7 years the child will be absolutely all right. But nowadays exactly opposite is taking place. A mild autistic nature which is present there in the child is now developing into bigger and bigger, because we have so many aggravating and challenging factors which increase the autism. So we need to think it very, very carefully about this particular part. So if you observe, slowly we are get isolated. Slowly we are get isolated. So nowadays we are living in the imaginary world. You just think what are the entertainment that you are giving for your baby? Nothing. You are providing sometime mobile, sometimes some other social medias, baby is busy with that, or TV, and some imaginary things are going. See, where is the interaction? I want to say, where is the interaction? These are the monotonous things that child is doing, okay, mechanical things child is doing, and he is watching the TV continuously, doing the cartoon, and this is a mechanical thing. Whether there is any interaction, that interaction is very important to prevent the autism. Okay, interaction is very important, and there is less exposure to the society. Nowadays less exposure to society is maybe due to various factors. Okay, nowadays COVID is one of the important situation which created so many autistic children. Okay, in the COVID times the child was never let to go out and confined to the room itself. Okay, and that is one thing. Sometimes there may be some disorders spreading in the society, because of which we are restricting our children from going out. Sometimes overcautiousness may be also the cause, or sometimes security problems also there, insecurity and security problems. Therefore, we are not letting our child go out. See, but all these factors are contributing for increasing trend of autism. Just remember, now we are isolated. Previously we are there in the joint family, then we come to the nuclear family. In the nuclear family also, now we are confined to one particular room. In the one particular room also we are confined to one particular place, and in one particular place also we are confined to one particular item like mobile, TV, etc. So we are totally get isolated from the others. So how come you imagine that? How come you imagine that the social developmental skills and as well as language skill of the baby should go increase when you're not at all interacting? Therefore, in the Shastra, it is very clearly told that at least you have to talk 100 words per day with your baby. Then only the vocabulary or the mental dictionary of the child will going to increase, and then baby is able to reproduce these things. But you are not at all talking to your baby. You may be giving all the facilities, but there is no interaction. Definitely the trends of the autism will going to increase. So this will be clear when you think retrospectively. Unless and until we correct all these problems, interaction, okay, and the social involvement, interaction, then mixing together and playing with all, development of emotions, so the autism cannot be controlled. Now this is an increasing graph now, dangerously increasing, and so therefore this is the right time to think, so what we have did so far and what are the corrections needed. See, first 6 years if the baby comes to you, so then chance of recovery is more, but it is better to correct this in the beginning itself. See, in the previous days, olden days, although it looks very crude, the mother, they used to sing the Lori to the child when to make him sleep. That was the initial step of identification of autism. If the child is responding for your song, that suggests that baby's auditory input and output is okay. He is responding for that. Okay. So such a way, we in olden days we have got our own method of diagnosing and own method of treatment. But nowadays we are missing it. We are diagnosing the autism mild, moderate, M chart, everything is available. But when we start thinking about prevention of this, so this prevention is only possible when you give much exposure to the baby, when you communicate with the baby from the beginning itself. A mildly autistic nature which was present there will also going to disappear as the day passes if you continue this trend. Otherwise, a mild autism also get converted into a full-fledged autism in the coming days if the child is not interacting with everybody. Okay, of course, modern investigation says there are some mutations and all those things. Although autism is not a hereditary problem, it is not a single gene problem, or it is not a mitochondrial inheritance. Like that, inheritance is not seen. Some of the mutations are made responsible for this autism, but the responsibility of the parents, society, and all of us is there to produce less and less autistic child in future. Thank you very much. I hope you think seriously about this aspect. Thank you very much. We will again meet with another class. Thank you very much.